Biological results, considerations and feedbacks. Periodic checks after the application of the prosthesis in the patient's mouth. This clinical case, showing a prosthetic rehabilitation realized in July 2009, has already been published in the first version of the Bononia Implant System DVD in May 2011. We're introducing it again in this new version of the DVD and on our website in order to evaluate the patient's clinical course and his current state 6 years after the rehabilitation. Results, considerations and feedbacks. In March 2009, the patient was submitted to 6 teeth extractions, 6 implants were placed, and 6 OT equator biologic abutments that will never be removed were screwed into every implant. In the same surgical session, a provisional threaded reinforced bridge was applied with an immediate loading technique. 4 months later, once the implants were osseointegrated, the definitive bridge was applied without removing the OT equator biologic abutments from the implants in order not to lose the cohesion between the gingival tissues and the titanium surface and to maintain the biological barrier. The patient, who had never respected the anterior planned checkups, showed up to the clinic for the first time only 2 years later at the end of 2011. Starting from that day, the patient's behavior didn't change, ignoring the planned appointments and the callbacks. The patient showed up spontaneously only 3 years later, asking for treatment for a toothache in the inferior arch. It was due to the presence of some granulomas, identified by comparing the older panoramic radiograph and the current one taken in May 2014. In this occasion, the superior prosthesis was removed, allowing the clinician to notice the very poor hygienic conditions. OT equator biologic abutments were found surrounded by large amounts of plaque, which had never been removed in the previous years. A simple wash with air and water has been sufficient to verify the good health conditions of the gingival tissues. Checking the radiographies, you can notice how the cohesion between the tissues and the titanium surface has really acted as a biological barrier. In many other cases, the presence of this biological barrier helps to maintain a good osseointegration and, consequently, good condition of the implants. Many intraoral radiographies from different patients showed how the bone didn't decrease, instead remaining at the level where the OT equator abutment and the implant joined. These clinical cases are shown without the claim of any scientific conclusions.